right, so it's no secret that right now healthcare costs are full on insane. I feel it, you feel it, Nate feels it, we get it. So Nate, the benefit broker, as an employee, what options are available to me? How can I help control rising healthcare costs so it doesn't bankrupt my family if something happens?
Well, priority number one is preventative conversations and preventative ways to be able to protect you and your family is by doing your annual physicals, by looking at your health holistically. Obviously, we always talk about what you eat and also how you exercise. But at the end of the day, the care does happen, things occur. So the priority number one is, do I need to go to an emergency room? Can this be done through an urgent clinic? Can I go to my primary care physician? Your top costs and most expensive costs as an employee and employer are going to an ER. We need to do it. It's definitely something that's important, but consider what your other options before you go to a high cost center that's going to charge you a ton. Again, your family and individual situation, we said this in other videos, is important to think about. The other thing is employers are offering tools and resources to ask the questions. The other part of this that's important is it in network or out of network? You want to stay in network as much as possible. And there should be tools and resources available to you, whether it's via the app, through whatever carrier that you're utilizing to see what is in network or out of network. There are also other apps that we provide in the market to give people direction, or what we call steerage, to provide the ability to go to the right care center and get really quality care at a cost that's more aligned to your potential budget. But ask the questions and make sure you're asking for cost of care, because we don't typically do that. We ask for costs and everything else, but we don't ask for costs in healthcare. And you should ask for that cost before you do it, because there are cash pay options and there are options to consider when it comes to large expenditures for you and your family.
Yeah, right now, I have a doctor, even though I have health insurance, I have a doctor right now, I'm not using my insurance. I'm paying cash because it was cheaper to pay cash than it was to run it through my insurance. Nate's totally right. Ask the question. If you have additional questions, we've got additional content. Check out my YouTube channel, North Star HR, or have a conversation with the benefits broker associated to your employer.